would you please stand and join Chaplain John Gerhardt, and then we'll do the Pledge of Allegiance.
Thank you, Chairman. Would you bow your heads with me as we pray? Lord our God, our hearts are troubled as we have seen a global pandemic arrive on our shores. Yesterday, our American president called for a national day of prayer, so we continue in a spirit of prayer this day, knowing that, especially in times like these, we should pray without ceasing. The coronavirus has our world in a state of high alert, so while we do all humanly possible to combat this disease, we also call out to you for divine help from above. We ask for comfort for all those around the world that have lost loved ones to this virus, and we ask for your hand of blessing upon those who are sick and seek to regain their health. And we pray earnestly that you would guide us here at Sarasota Memorial as we seek to navigate through the intricacies of unprecedented healthcare concerns. Protect our staff, we pray, as they pour out their energy and efforts day and night in the service of the sick in our community. Deepen our care and compassion for those who suffer. And bless this, our hospital board and leaders, with insight, with foresight, and with a sense of peace and purpose as you lead and guide us to bring hope and healing to all those who come to us in need. These things together we pray. Amen.
Amen. We'll do the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Yeah, I would ask the people who are calling in to mute their phones and unmute them if you have to speak, please, because we can hear it here if not. Good afternoon. I'd like to call the meeting to order, and I am required to read the following statement regarding public comments. Any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. If the citizen comment pertains to an item on the agenda today, the comment will be heard earlier in this meeting. Otherwise, it will be heard toward the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, or persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for the bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments or discuss or negotiate claims at this meeting. Okay, first of all, I want to note that some of our members are appearing via teleconference today, and we are removing non-essential items from our consideration and recognition of the CDC guidance on social distancing. The first item, or third item on the agenda is approval of the orders of the day, sorry. And Britt, I believe you have a motion for us?
I do. Thank you. I move approval of the orders of the day as amended to remove items 5, 6, 7, and 9B.
And can we have a second?
I'll second the motion.
All those in favor respond by responding, say yes.
Yes.
Please. Opposed? None, and so carried. Thank you, Brett. The approval of the minutes of the meeting of February 18th. I'd ask for a motion approving the minutes, please, and seconding it.
So moved.
Second.
So we have a first and second. All in favor respond by saying yes.
Yes.
Opposed? No. Carried. Thank you. As many of you know, our friend and colleague Bill Noonan resigned his seat after the last meeting. We wish Bill well as he moves north to spend time with his family. He could not be here with us today, so without objection, we will enter the resolution into the record.
You don't need a motion or anything for that, it's just without objection, you guys all received a copy of the resolution recognizing Bill's service to the board.
Okay, in light of Bill's recognition, we have a redesignation of officers. I believe that Mr. Carter has a motion.
Yes. At this time, I'd like to move election of the following slate of officers for the remainder of the 2020 board year. Chair, Mr. Jim Meister, and first Vice Chair, Dr. Dick Raymeyer. I second the motion.
All in favor of the motions, answer by responding yes.
Yes.
Opposed?
Yes.
Opposed, no. Motion carries. Thanks, Greg. Discussion of replacement for Central District C. The board has the obligation under our enabling legislation to appoint Mr. Noonan's successor. Further to that, we will be interviewing candidates at a specially scheduled public meeting, which will be noticed, and hope to appoint a successor at our April meeting. The next item is the appointment of members to the Physician Service Board. Our final obligation related to Bill's departure is an appointment of a board member to take his place and maintain a majority control of our physician's practice. Again, I believe Mr. Carter has a motion. Greg, would you read it, please?
I move election of Britt Reiner to the Board of Physician Services, Inc. I'll second that motion.
All those in favor respond by saying yes.
Yep.
Opposed, no. Motion carries. Okay, the following are all going to be taken as a group. Dr. Schulman will introduce them, and Sharon will make the motion and ask for a second approval. Doctor?
All right, so we have a number of items on, that need board approval this month. They all come with the recommendation of the Medical Executive Committee. I'm happy to answer any questions you have about these motions. The TAVR motion is now off the agenda, but we expect that back in an upcoming meeting. I do believe Ms. Wexford-Peters has the list of motions remaining.
Yes, thank you, Dr. Schulman. I move approval of the recommendation to approve privileges for heated intraperitoneal chemotherapy, the recommendation to approve the special privileges for fecal microbiota transplantation, the recommendation to approve the advanced practice professional scope of privilege form, the recommendation to approve the cardiology department level 4 advanced interventional devices criteria, and lastly, the recommendation to approve stroke alert criteria as recommended by the Medical Executive Committee.
Have a motion? Second?
Second.
All in favor? Respond by saying yes, please.
Yes.
All opposed?
Yes.
No. Motion carries. Thank you.
That is the end of my report.
Thank you very much. And now we go to Mason, I believe. Foundation report.
I do not have a report today.
Thank you, Mason. Secretary's report. Britt, please.
Thank you. The next meeting is scheduled, board meeting is scheduled for Monday, April 20th, 2020, from 9 to 10:30. It is the Mission and Planning Committee. From 10:30 to noon, the Quality Committee. From noon to 12:30, there is a closed session of the hospital board. From 12:30 to 2, there is the board lunch and issue and financial review. And from 2 to 4, there is the board meeting. That concludes my report.
Thank you very much, Britt. Treasurer's report, Joe DiVirgilio, the approval of bad debt and charity. Please, Joe.
Yes, I have one proposed motion. I move approval of the bad debt and charity care for the month ending February 29th, 2020, in the amount of $25,435,000.
Okay, we don't need a motion on that?
You did.
That wasn't a second.
All in second, and all in favor, please respond by saying yes.
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 And opposed, no. We carry. Bill, you're up. Thank you.
Thank you, Mr. Chairman. I have the financial highlights for February. February being the 5th month of our fiscal year, All the fiscal year-to-date numbers represent 5 months of activity. We'll start with the total revenue for the system in the rating agency format. February had $91,377,000 of total revenue compared to a budget of $89,403,000. Fiscal year to date, we have total revenue of $446,089,000 compared to a budget of $430,917,000. Total expenses for the system for February, $82,533,000 compared to a budget of $81,813,000. Fiscal year to date, $405,774,000 compared to a budget of $403,075,000. Operating income in the rating agency format, this is at the system level for the month of February, $8,844,000, which is an operating margin of 9.7%, comparing favorably to the budget of $7,590,000, which was a budgeted operating margin of 8.5%. Through 5 months of activity, we have operating income of $40,315,000, generating an operating margin of 9%. And this compares favorably to the budget of $27,842,000, which was a budgeted operating margin of 6.5%. Moving on to statistics for the hospital. Average daily occupancy, and these are all 5-month fiscal year-to-date numbers. Average daily occupancy of 615 compared to a budget of 569. We have an average acute length of stay so far 4.29 days, very close to last year's 4.30 days. Admissions so far 19,007 compared to a budget of 18,184. Surgery cases 10,528 compared to a budget of 10,712. And through 5 months of activity, we have births of 1,654 compared to a budget of 1,616. For the hospital's outpatient registrations, we have 204,470, very close to the budget of 205,863. Registrations in our 2 emergency care centers, 54,432, compared to a budget of 52,203. And so far, this fiscal year through 5 months, we have case mix index for all patients of 1.79, and for Medicare patients, 1.90. Mr. Chairman, that concludes my report.
Thank you, Bill. Continuing with our agenda on committee reports, Joe has already reported on the Governance Effectiveness Committee. I'd call on Sharon DePeters, Vice Chair, to give the Finance Committee report, please.
Yes, thank you, Mr. Chairman. The minutes of the January 28th, 2020 Finance Committee were approved. Next, we had David Patterson, RN, ACNO, who presented a request for funding to renovate Electrophysiology Lab Number 3, including the purchase of new equipment and construction, with the total project not to exceed $2,500,000. This is included in the fiscal year 2020 capital budget. The volume of electrophysiology cases continues to grow. The renovation of EP Lab Number 3 will bring it current in technology to better serve our physicians and patients based on that presentation. I move approval of the cost of the renovation of Electrophysiology Lab Number 3 as budgeted in the fiscal year 2020, with the total project cost not to exceed $2,500,000 as recommended by the Finance Committee.
Do we have a second? Second. All those in favor respond by saying yes.
Yes.
Opposed, say no.
Yes.
Motion is carried. Thank you.
Okay. Next, we had Bill Wojin, CFO, and Jane Parker, RN, Clinical Manager, who presented a review of the performance of the Cape Surgery Center. They presented information on the types of cases performed at Cape, as well as the payer mix and financial results. Cape Surgery continues to have a positive margin and high satisfaction rate among surgeons, patients, and staff. There is no motion necessary. This is for our information only. Next, we heard from John Salt, Director of Engineering and Campus Facilities, who presented the recommendations made by the Selection Committee for architect/engineer and general contractor for the invasive cardiology expansion project. Based on that presentation, I move approval of the ranking of the following entities for architect and engineering and general contractor services for the invasive cardiology expansion project as recommended by the Public Selection Committee and the Finance Committee. For architects/engineers, number 1, LDC International. Number 2, Grisham Smith. Number 3, Plunkett Racish Architects, LLP. For general contractor, number 1, DeAngelis Diamond Construction. Number 2, J2 Solutions Incorporated. Number 3, Creative Contractors. Next, we heard from Bill
I
Wojin.
think you just made a motion that needs to be seconded.
Yes.
Oh, I'm
Please.
sorry.
No, it's
Thank you.
okay, I know.
Thank you.
Second.
All those in favor respond by saying yes.
Yes.
Opposed, answer no. Motion's carried. Continue,
Okay,
Sharon.
I'll
Thank you.
continue on now. Sorry. Next, we heard from Bill Wojin, CFO, who updated the Finance Committee on a recent report from Moody's Investment Services on their outlook for not-for-profit and public health care. Moody's revised their outlook to stable based on the projections for the industry. Moody's stable outlook for the industry is based on their expectations for operating cash flow to grow by 2 to 3% and for consolidation to continue at a brisk pace in an effort to gain scale and boost revenue. Again, there is no motion necessary. This is for information only. Lastly, we heard from Nelson Lane, who presented the district's credit profile as of September 30, 2019, and graphs showing historical trends of our financial ratios. For many ratio metrics, the district is performing better than the median metric of similarly rated healthcare systems. No motion is necessary. This is for information only, and this concludes my report, Mr. Chairman.
Thank you, Sharon. Now we'll have our president's report by David Verinder, our president and CEO. David?
Thank you, Mr. Chairman. I'm going to start today, as we do each month, with our organizational report card. And we look at our 5 different categories, first being service. We have our goal of having our likelihood of recommending number of service areas greater than or equal to the 75th percentile. We have a goal of having 8 out of 10. Happy to report we are maintaining our 10 out of 10 score for the 3rd month in a row. I'll show you the details on that here in a minute. In the people category, we have a goal of having our turnover of part-time and full-time employees that have been hired within the last 12 months being at 24% turnover or less. Happy to report we are exceeding that goal at 23.22%. Quality, we have our goal is have our infection prevention, which is our combined overall standardized infection rate of being less than 0.93. At the time of this publication, I didn't have that tallied completely, but I can guarantee to the board it's less than our goal. So we're still doing well on that. Just has some data that didn't come through. Next category is finance. As you heard from our Chief Financial Officer, Bill Wojin, we have a goal of having our operating margin, which is our budget, at 6.5%. We are projecting that to exceed that at 7.6%. And finally, growth. You have 2 goals in growth. One is our inpatient admissions and observation outpatients having a goal of 46,000 patients for the year. We are projecting to exceed that at 53,151. And our outpatient registrations, having a goal of 895,000, we are projecting to exceed that as well at 963,000. Kind of looking a little deeper into the patient experience report card, you can see that in all 10 categories, we are exceeding both the national median score and the 75th percentile score for likelihood of recommending. I know, please clap. It's something that our team works extremely hard at, and something that is not easily achieved. So we very much thank them for that. I do want to take a minute and talk about COVID-19. At Sarasota Memorial is working closely with health officials at the local, state, and national levels to help keep staff, patients, and our community safe. Our infection prevention team and hospital leaders are meeting frequently to discuss plans and guidance. We've opened up a 24/7 coronavirus command center to provide staff and local health providers and others with information and guidance. We launched a public coronavirus hotline, and you can see the number there, offering local coronavirus information that is updated regularly. We have a lot of advice to staying well during these difficult times. I would say that a couple things. One, we invite you to go to our website. Our website has the latest information on it. Very easy to find at smh.com. It'll be the first thing you see when you go there. And then I would also ask you, and it'll go into a little bit more detail in this, but continue to practice social distancing. It is understood and proven to be the best method for reducing the exposure to this virus. So we invite you to stay informed, use common sense, and to take guard against illnesses such as the flu as well. Wash your hands frequently with soap and water, or use alcohol-based hand sanitizer when hand washing isn't an option. Cough or sneeze into your sleeve or the crook of your elbow, shirt, or a tissue, and not your hands. Avoid touching your eyes, nose, and mouth, which I appreciate is very difficult. And it's all I can do not to touch mine now, but I'm not going to do it, okay? Stay at home if you're sick. I get counseled about that, by the way, a lot, about the touching of the face. Clean commonly touched surfaces in your home and workplace with bleach, ammonia, or alcohol-based disinfectants, and do it often. And if you develop a fever, cough, or difficulty breathing, call your healthcare provider for instructions on how to seek care without exposing others. So to be very clear in that, we advise you to call your doctor if you become ill. And don't go to the doctor's office, don't go to the ER, don't go to the urgent care. Call your physician, let him or her instruct you where to go from there. And they very well may send you to the ER, they very well may just send you home to recuperate. But that would be our best advice. Okay, enough about COVID-19. Some good news. Sarasota Memorial was named a world's best hospital for the second time by Newsweek magazine. SMH was one of 10 hospitals in Florida to make the list, which spotlights over 15 hospitals across 21 different countries. Hospitals were selected based on medical performance indicators and included low mortality, complication, and readmission rates, as well as recommendations from medical professionals and patient survey results. Virtual reality aids aids clinical staff designers on SMH-Venice hospital project. So as everyone knows, we're building our new hospital on the corner of Venice and I-75, slated to open in the fourth quarter 2021. But we had a chance to have our architects and designers come in with 3D models of the rooms and walk through, and everybody got a chance to walk through those rooms, which is a very odd experience if you've never done that. But it's something that really helps our teams understand how relationships to supplies and the caregiving areas are and how patients will experience it as we're designing. So the construction progress on SMH-Venice, you can see the pictures here, and I'm sure these are already dated. I think Sharon Roush, our president, are you here? Yeah, Sharon. When did you say the walls were going to start going up?
Yeah, this week.
This week, so yeah, it's going to look, it's going to be looking a lot more like a hospital pretty quick. So we have new drone footage showing the beginnings of the new medical office building that will house our physician practices and support the new hospital. And once again, planning on opening fall 2021. Construction progress on our radiation oncology center. Work continues as the facility prepares to open in August of 2020. The first of 2 TrueBeam linear accelerators has been installed, and our outdoor paving and landscaping has begun really taking shape. The oncology tower, which is the new cancer tower on our main campus, is going up very quickly. Our foundations are complete. The remaining pile caps have been poured. Columns and walls continue to progress vertically, following the deck pour sequence and foundations scope. Block along the east face of the Waldemere Garage is complete, and in transition planning is ongoing. And the tower is also scheduled to open in the fall 2021. SMH this past month appointed a breast program director for the Cancer Institute. Sarasota Memorial is pleased to announce the appointment of surgical oncologist Dr. Russell Novak as its breast program director for the Cancer Institute. A board-certified general surgeon with specialized expertise in the treatment of benign tumors and malignancies of the breast, Dr. Novak has practiced in Sarasota since 1986 and has held multiple leadership positions at SMH over the years. As director of the Sarasota Memorial Cancer Institute Breast Program, Dr. Novak will lead a multidisciplinary team of community breast oncology specialists and surgeons responsible for establishing care pathways and implementing the latest innovations in breast cancer treatment. So please congratulate Dr. Novak. Team SMH donates over 1,200 pounds of clothes to help those in need. Thanks to staff's generosity, Sarasota Memorial's recent closed closet drive gathered 1,270 pounds of donated clothing, nearly double that amount of last year's. The collaboration between Goodwill, Minnesota, and Sarasota Memorial, the drive provides clothing to help stock the SMH clothes closet for patients who need fresh clothes, and also supports the less fortunate in our community. So we appreciate the team that puts this on each and every year. We also had the opportunity this past month to celebrate Black History Month. So SMH celebrated Black History Month in February, and our Diversity and Inclusion Council hosted a special luncheon with a keynote speaker, Diversity, Equity, and Inclusive Officer Corey L. Posey of the University of South Florida, Sarasota Manatee. So thank you for all those who participated and came out. And Mr. Chair, that is my report. I would be happy to answer any questions.
Are there any questions of David? David, I speak on behalf of the board to say thank you to you as our chief executive and to the 1,400 physicians who practice medicine here, and the nurses and over 7,500 of our staff people who have weathered the beginning of the storm. And under your leadership and your sacrifice and the sacrifice of all the people, we'll see our way through this. We don't know when, but we'll come out better than we went into it, and thank you very much.
Mr. Meister, I appreciate that. I appreciate that very much. I know our staff, medical staff, and employees and volunteers very much appreciate you saying that as well. I will definitely carry your message back to them. It's such a incredible team to be able to lead with people who care deeply for this community and the people here. And thank you for your leadership, for each and every one of you on the board during these times.
Thank you.
Thank you.
Okay, consent agenda.
We have nothing?
Karen, any public comments?
No, sir.
Legal matters, Carol Ann?
I only have one thing. We have an SMH-PSI board meeting that is scheduled to take place today at 3 in recognition of the CDC guidelines with regard to social distancing. And because this meeting finished so quickly, we're going to have that as a call-in meeting, and Karen Marshall will have the number, but I'll publish it now in case there's anyone listening who wants to call in. Tell me the number and I'll read it into the record.
941-917-5300.
Okay.
And I have to give you the access code is 034166422.
Terrific. Thanks so much.
Any other business?
Mr. Chairman, I'd just like to make a recognition. I'd like to recognize Sharon Roush. This past Saturday, I had occasion to speak at a church in South Venice, and they wanted me to talk about the hospital, the new hospital that's being built. So I thought I'd invite Sharon, since she is the expert, and she did a tremendous job. It was very well received. I know she has talked to different organizations and groups, I'm sure many, many dozens, but there were only 11 people there, but she treated it like there were 111. So she did an outstanding job, and thank you very much, Sharon.
Thank you, Sharon. Any other business? Hearing none, I take a motion to adjourn. Second? Thank you very much.
Thanks all.